In this healthcare debate, philosophy matters. This healthcare reform debate presents American citizens with the mother of all teachable moments. Soon, Americans and our elected representatives will have to choose between two distinct paths for the future of this country and American medicine. Will we enshrine healthcare as a right for all and create a socialized system like other countries and turn 20% of our economy over to the government control? Or will we treat healthcare like the vital service it is and incentivize citizens and the private enterprise system to create solutions to the problems we face? Don't be fooled by the rhetoric. Both the House and Senate bills will lay the foundation for single-payer government healthcare and the gradual destruction of the individual insurance marketplace. When I say philosophy matters, what do I mean? What I mean is that we all must clearly understand the implications of turning healthcare into a right. Healthcare is a service that is vital to a society, but essentially no different than the food, transportation, energy, or other daily services we all rely on. Food is certainly more important than medicine, but as of yet, we have not enshrined food as a right and guaranteed that everyone has a daily steak dinner. What America has done is to allow free market incentives to create a food industry that not only provides for our citizens, but also feeds the world. We need to do the same with healthcare so that all Americans who need healthcare can get it, and that we will continue to lead the world in medical advances. The government should not be involved in any medical decision making. The Constitution does not guarantee healthcare to its citizens. In its remarkably succinct 6 pages, healthcare is not mentioned because this document only protects the natural rights of life, liberty, and the pursuit of happiness. The Constitution thereby protects individuals' private property and their freedom to make decisions for themselves. If you believe healthcare is a right, you are choosing to relinquish your freedom to control your own health decisions. You will relinquish your freedom to choose insurance that fits your needs. You will relinquish your freedom to establish a personal relationship with your doctor, as this relationship will now involve the government. By saying healthcare is a right, you are stating that the government has the power to make choices on your behalf. The House and Senate bills create numerous new government bureaucracies that will dictate how healthcare will be delivered, what and whom gets covered, and who pays for the privilege. Remember that if medical care becomes a right, then there is a corresponding duty of others to provide that right. In other words, Obamacare actively gives the government the power to choose, provide, limit, and even take away health care for you and your family. It is an absolute lie for the president to state that citizens will be able to keep their current insurance, as the seeds for the destruction of these plans is clearly laid out in the House and Senate bills. Oh, yeah! Physicians. Making healthcare right means that eventually you will have to choose between violating your Hippocratic oath by following government mandates or illegally giving your patients the care they need. Philosophy matters because Americans need to know that underlying the current reform bills is the philosophy that the government knows better than the individual when it comes to healthcare. Restructuring healthcare using a socialist approach has always failed to provide the care patients need, and also has the real potential for fiscal catastrophe. I would like to quickly illustrate 2 aspects of the House bill that will illustrate this. The universal benefit mandate. Okay, listen to this. What if the government told citizens that they had a right to food and must therefore buy the same basket of groceries each week? A government committee consisting of political appointees and a few representatives from the meat, dairy, and vegetable industries devised the list of items that must be purchased each week. People could buy more items if they could afford it, but if you're lactose intolerant, hate wheat bread, and are allergic to eggs, you'll be forced to waste your money on a weekly basis. This is obviously a crazy idea, but analogous to the uniform benefits mandate in the House bill on page 104. Every health plan in America will have to offer the same mandated benefits. Benefits will be determined by the Health Benefits Advisory Committee. The members of this committee are appointed and not answerable to the electorate. As with most entitlement programs, the incentive will be to add benefits and reduce cost sharing over time. The result will be increased costs and a loss of freedom and autonomy for Americans. It will be structurally impossible for individuals and families to shop for a low-cost plan that fits their needs because every plan will essentially be the same nationwide. Most independent analysts believe that this universal benefit mandate will make basic insurance many times more expensive than it is now. As Henry Ford once said, a customer can have any color they want on their Model T as long as it's black. This new mandate clearly shows how making healthcare rights eliminates a citizen's ability to choose a low-cost health plan that fits their unique needs. Now I want to talk about the medical home program. My second example of lost freedom created by the making of healthcare right is the medical home pilot program. This plan will create primary care gatekeepers for Medicare patients. In fact, this gatekeeper may not even be a physician. The medical home program clearly states that Medicare patients may have their health care controlled by a nurse practitioner or physician assistant without direct physician supervision. This will end the current fee-for-service arrangement that allows our elderly to seek out whatever physician they wish. They will have to get approval to go to other physicians from this gatekeeper. HMOs tried the gatekeeper model back in the 1980s, but it didn't control costs well and was universally disliked by Americans. I guess Nancy Pelosi thinks our seniors won't mind this time around. The goal is to roll the medical home program out nationwide as rapidly as possible. This is an example of a radical shift in the Medicare program and a way to control costs in an intrusive way. Current bills before Congress will cut over $450 billion from the Medicare program to help pay for the new system. Seniors will be greatly affected by these changes. Why the AARP supports such radical change is a question that our seniors should ask. We can see that making healthcare right has many unintended consequences. What do physicians see as a solution? We believe meaningful healthcare reform should have at least these components. Empowerment of individuals and families, not the government, to make healthcare decisions. The elimination of state insurance monopolies. Health insurance tax equity and insurance portability, so you take your insurance wherever you go. Decreased administrative costs, malpractice reform, and the development of creative high-risk pools to allow cost-effective access to those currently denied insurance. Okay, let's wrap it up. Changes that will benefit our patients and our professions will not arise by a government takeover of healthcare. The medical advances we use daily in our practices did not come from the government. America has the best healthcare in the world because individuals making independent decisions in our free enterprise system create the innovation and improved care. Let me repeat, will we treat healthcare like the vital service it is and incentivize citizens in the free market to create solutions to the problems we face? This is the real challenge, as government does not create, it only controls and redistributes. Thomas Jefferson said that a government big enough to give you everything you want is strong enough to take everything you have. We today should heed this warning because healthcare as a right will lead this country down a path that we, physicians, and our patients will all learn to regret. Thank you.